2 years are an advanced program when you already have done the basic training. It's about 136 hours to fulfill the requirements for a European diploma in the ESH. What do you learn in this program? Well, you learn to use your own creativity, but more to evoke the patient's creativity, to use the patient's playfulness and creativity and resources to heal. In treatment, patients come with various diagnoses. They may be obsessive compulsive, they may be diagnosed as depressed, as anxious, having kind of anxiety problems. For hypnotists, it's not so important whether the diagnosis has a name or not, because the common purpose in all hypnotherapy, which we practice in the 2-year program, is to find what does this specific patient need in order to become herself or himself. Because everyone is born with a life lust, a lust to live, a motivation to live. We have that inherited, and we find that again with so many various techniques. We use our own relation to the patient, because many patients need to test if you can be trusted. So the relational part is included in the training program. We don't teach a lot of techniques only, because all research shows that it is not only the techniques that cure our patients, but it's the safe relation. And then, of course, we must have some fun too as therapists. And if we find techniques and methods that suits our personality, that we like, then we are so much better in our profession. And that is a help for our clients. So if you don't like to be creative, if you don't like to be surprised, if you want to be sure about each step in the process and how to plan and to follow your plans and your structures in the therapy, don't do this program. But if you like to be surprised, if you like to play, if you like to be challenged and find ways to accept resistance and doubts and develop yourself, then this program can be very good for you. So then the content is, of course, the medical hypnosis, psychological hypnosis, in psychotherapy, in medical treatment, and psychosomatics. Psychosomatic hypnosis is a psychological technique. It is not a medical technique. The technique is psychological because you are using your patient's mind. But there we have a holistic perspective, which means that body and soul is one. It's a mutual influence both ways. So there are top-down methods and techniques for certain medical conditions, and patients can be surprised how strongly they can influence their body and even organic problems. And on the other side, in pure psychotherapy with anxiety and depression and no somatic complaints, we can help the patients to discover the cause of their problems and discover the resources that they didn't know they have. So that is a little of a smorgasbord of what we have to offer. In the class, when we teach, we mix teaching approaches. We teach, we talk about theory and general principles, of course, because that is something you have to do if you will be certified, have some general knowledge What is the most common principles with this and that diagnosis? And then we also have supervision. So you are, as students in this program, of course you are very motivated to help the patients that you see right now. And you bring the stories or your story about your patient. You pick a patient and you tell about the patient. What you know about the patient, what you have done so far, and then I give some kind of input, what I think would be good for you and this patient, how you could continue the process. We can do this supervision in small groups. Sometimes when I teach abroad, the supervision is in bigger groups, but that is variable. The main point is that you receive some creative input how to do this work with hypnosis with your specific clients. So that is the supervision part, and that will be included every day, 1 or 2 hours each day.